healthcare. We already know that healthcare was anything but affordable. We had mentioned that yesterday as we talked with Seth Denson, the author of The Cure, as we are now 12 years into the Not So Affordable Care Act. And what's happened to healthcare costs over that period of time? Well, they have become 4 times less affordable for the average American. So here's the bigger thing. As we have inflation hitting all aspects of our society, the healthcare inflation, unlike the other forms of inflation, like fuel, perhaps food, may not go down. Paul Seegert, PCS Advisors, here to talk about this. Paul, thanks for joining us again.
Thanks for having me.
Okay, so what is it about the healthcare inflation that's different than, say, the commodity inflation?
Well, in the game of healthcare and the way that we play it in this country, when you raise prices, they never go down. And you see that in your insurance premium. Raise your hand if you've ever had your insurer come to you and say, we're going to lower your premiums this year. And that's really just a reflection of actual healthcare costs. And it's already been inflationary before the times that we're in currently. It usually rises 2 to 2.5 times faster than CPI and inflation data does. And unfortunately, that's not untrue now. We're looking at 11.9% inflation in healthcare this year and next year at least. Hopefully it will taper off after that or slow down a bit back to just, half that or so. But it's a scary proposition for people.
How much of that is legit business conditions and costs versus how much of it is opportunism within the industry?
Well, that's the whole thing right there. We lack transparency. People ask me if you could fix it in one word, what would it be? Transparency.
Amen.
And with that lack of transparency, we get so much profiteering. Drugs are inflated about 2x what they should be, and often more than 2x what other countries pay for the exact same prescriptions here. And that is true in other parts of our system. Hospitals have more than 150 prices for every procedure they perform on average. I looked at a heart procedure in a California hospital recently, and it was between $80,000 and $540,000. Same surgeon, same OR, same procedure, all depending upon who the payer is and the plan that you're a part of. So we have a lot of waste that exists with this lack of transparency, and I keep thinking it's at a breaking point, and yet it just gets worse. Right now, if you're a 65-year-old healthy couple going into retirement, 68% of your Social Security payments are going to pay health care costs, and you're going to need $662,156 to make it till the end of your life just for health care. That's pretty insane.
Good times for sure. And Paul, your point about transparency, I mean, amen. It's something I've talked about for 20 years now. It just drives me crazy how we have an insurance first model to where there isn't that transparency. What my analogy has always been, if we get in an auto accident, we'll file a claim and have our car repaired. But if we need an oil change, then we go and we get our oil change. We pay for all the basic. We do that in every aspect of life, but we don't do it in healthcare. We are in league with this back crap crazy system whereby we walk into a doctor's office. We don't exactly know what's going to happen. Even if we have an idea, we don't know exactly what's going to happen when we get in there. We have no idea how much it's going to cost. But we signed a piece of paper that says, whatever happens in there and however much it costs, I'll get that if my insurance company doesn't. And, Paul, the system is so backwards anymore. You ask, if you are trying to be proactive, and you ask your healthcare service providers how much various different things cost, they can't tell you. And because they won't even tell you until they figure out what your insurance company is going to do. There is no transparency.
Yeah, we don't have a free market, and I know a lot of critics of our system say that this is evidence that capitalism and free market forces don't work. It's actually quite the opposite. You can look into our system and find examples that are working in healthcare where we do not have the insurance payment model involved, and we don't have that veil and lack of transparency. Look at any elective surgery out there, LASIK, look at cosmetic surgeries, look at somebody that needs a vasectomy reversal or whatever. If you look at the prices for those things where there are free market forces acting, you get higher quality and lower costs year over year. It's really where we don't have free market forces that we have all these problems, which is where the government could do some good work. Make it create a framework where free market forces can operate. But with the laser precision lobbying that this industry does, that I don't have a high level of optimism that that's right around the corner.
Well, Paul, I appreciate the insight. I think you're absolutely right, unfortunately. Paul Seegert, PCS Advisors. Enjoy your weekend.